We all crave those warm, sunny days, but did you know that sunshine does more than just lift your mood? Sunlight actually helps our bodies produce a vital nutrient, vitamin D. This sunshine vitamin plays a crucial role in keeping us healthy. Vitamin D is essential for strong bones. It helps our bodies absorb calcium, the building block of our skeletal system. Without enough vitamin D, our bones can become weak and brittle, increasing the risk of fractures. But vitamin D does much more than just support bone health. It's a key player in our immune system, helping our bodies fight off infections and stay healthy. Recent research suggests that vitamin D might even play a role in protecting us from serious diseases, including cancer. Let's explore the connection between vitamin D deficiency and prostate cancer. Prostate cancer is a serious health concern for men, and researchers are constantly searching for ways to understand its causes and potential preventive measures. One area of interest is the link between vitamin D deficiency and an increased risk of developing this disease. So, how might vitamin D deficiency influence prostate cancer risk? While the exact mechanisms are still being studied, scientists believe that vitamin D plays a role in regulating cell growth and development. When vitamin D levels are low, this regulation may be disrupted, potentially contributing to the uncontrolled growth of cells that can lead to cancer. Furthermore, vitamin D is thought to have anti-inflammatory properties. Chronic inflammation is increasingly recognized as a contributing factor to many chronic diseases, including cancer. By reducing inflammation, vitamin D might help create an environment that is less hospitable to cancer development. The link between vitamin D deficiency and prostate cancer is complex and still being fully understood. However, the emerging evidence suggests that maintaining adequate vitamin D levels is a prudent step for men's health. When it comes to prostate cancer, not all men face the same level of risk. Alarmingly, African American men are disproportionately affected by this disease, experiencing higher incidence and mortality rates compared to other ethnic groups. Researchers are working to understand the factors driving this disparity. One area of focus is the role of vitamin D. Studies have shown that African American men tend to have lower levels of vitamin D compared to other populations. This difference is partly due to skin pigmentation. Melanin, the pigment that gives skin its color, actually reduces the skin's ability to produce vitamin D from sunlight. This means that individuals with darker skin, including those of African descent, require more sun exposure to produce the same amount of vitamin D as those with lighter skin. In regions with limited sunlight or during winter months, maintaining adequate vitamin D levels through diet alone can be challenging for anyone, but even more so for those with darker skin. The combination of genetic factors, lower vitamin D levels, and potentially other socioeconomic factors likely contributes to the higher prostate cancer risk observed in African American men. Addressing these disparities requires a multifaceted approach, including raising awareness about vitamin D deficiency and ensuring equitable access to healthcare and preventive measures. The link between vitamin D deficiency and prostate cancer risk has been the subject of numerous studies. While the findings haven't always been consistent, a growing body of evidence suggests a connection. Some studies have shown that men with lower levels of vitamin D in their blood have an increased risk of developing prostate cancer. One large study found that men with the highest levels of vitamin D had a 52% lower risk of developing aggressive prostate cancer compared to men with the lowest levels. However, it's important to note that not all studies have shown a clear benefit. Some research has found no association between vitamin D levels and prostate cancer risk, while others have even suggested a potential increased risk with higher vitamin D levels. These conflicting findings highlight the complexity of this area of research and the need for more robust studies to provide definitive answers. Factors such as study design, participant characteristics, and the specific forms of vitamin D measured can all influence the results. While the research on vitamin D's role in preventing prostate cancer is ongoing, there is some promising evidence suggesting it may improve survival rates for men already diagnosed with the disease. Studies have explored the link between vitamin D levels and cancer mortality. Interestingly, some research suggests that men with higher vitamin D levels at the time of diagnosis or during treatment may have a better prognosis. A large analysis of multiple studies found that men with higher vitamin D levels had a reduced risk of dying from prostate cancer. This association appeared to be stronger for men with advanced stages of the disease. While these findings are encouraging, it's crucial to remember that correlation does not equal causation. More research is needed to determine if vitamin D directly influences cancer progression, and whether increasing vitamin D levels after diagnosis can improve survival outcomes. Boosting your vitamin D levels, simple steps for a healthier you. The good news is that maintaining adequate vitamin D levels is relatively straightforward. Here are some simple steps you can take. First, soak up the sun safely. Spending time outdoors and exposing your skin to sunlight is the most natural way to boost your vitamin D levels. However, it's crucial to do so safely and avoid sunburn. Aim for 10 to 15 minutes of sun exposure on your arms and legs without sunscreen a few times a week. Second, enjoy vitamin D-rich foods. Incorporate foods naturally rich in vitamin D into your diet. Fatty fish like salmon, tuna, and mackerel are excellent sources, as are egg yolks and fortified foods like milk and cereals. Lastly, consider a supplement. If you're concerned about your vitamin D levels, talk to your doctor about whether a supplement is right for you. They can assess your individual needs and recommend the appropriate dosage. Remember, while vitamin D is essential for overall health, more isn't always better. Excessive vitamin D intake can have adverse effects. It's always best to consult with your healthcare provider to determine the safest and most effective way to maintain optimal vitamin D levels for your individual needs. The exploration of vitamin D's role in prostate cancer is an evolving field with promising avenues for future research. Scientists are working to unravel the complex mechanisms by which vitamin D influences cancer development and progression. Clinical trials are underway to investigate whether vitamin D supplementation can effectively reduce prostate cancer risk or improve treatment outcomes. These trials will provide valuable insights into the potential benefits and limitations of vitamin D as a preventive or therapeutic agent. Moreover, researchers are exploring the use of vitamin D levels as a potential biomarker for prostate cancer risk or prognosis. By identifying individuals at higher risk, early interventions and personalized treatment strategies could be implemented. While there are still many questions to answer, the ongoing research into vitamin D and prostate cancer offers a ray of hope. By deepening our understanding of this connection, we can develop more effective strategies for preventing and treating this disease, ultimately improving men's health and well-being.